you very much for taking a bit of time to listen to this video. So I'm just coming to the end of my year's tenure as chair of the Aberdeenshire Community Planning Partnership Executive Group. So aware a lot of people will know the term community planning, but maybe just to take a second just to kind of talk through what our structure is in Aberdeenshire at the moment. So we have a CPP board, which is a huge, well-attended group of all of the major stakeholders in the community planning agenda. We then have an executive group, which is a kind of smaller group, and that's about who the statutory partners are, who are the ones that have absolutely got CPP on their agenda. And we meet as a kind of smaller, I suppose, working group who take charge of a lot of the business that goes on around community planning across Aberdeenshire. And then we have what we call our LOIP groups. So the first one is around changing our relationship with alcohol. Second one is around reducing child poverty. And the third one is around connective and cohesive communities. Now that's quite a broad term, covers quite a lot of issues, but it also covers the areas that we have specific locality plans in the CPP arena, and they are looking at Fraserburgh, Peterhead and the Bamford Macduff area. Within Aberdeenshire, we have a really strong community planning network. So that's historically been like that for a number of years, and I think it's probably just going from strength to strength. There's been some new legislation published in the last few years around community empowerment, and that's kind of shifted the focus from very much maybe the old scheme where it was council led and council were the area that were responsible for community planning to a much wider spread of all of the public sector and third sector, voluntary sector communities having a much greater role and responsibility in community planning. So where I think our real strength is in Aberdeenshire is that actually we do a huge amount of partnership working. It's actually just the way we kind of do things in Aberdeenshire. We've done that for a long time. My own service, Health and Social Care Partnership, that's so successful because of that experience and tradition that we have of working in strong partnerships. So that's why I think it works in Aberdeenshire. We brought in a new structure when the Community Empowerment Act came in, and I think probably what we've done with the executive group is we've got a much smaller, much more cohesive group that are really kind of working together to challenge ourselves and each other, to really kind of push the boundaries around some of this. So for me, where partnerships working really well, please let's just go on with it and do more of it. What the role of that executive group is to really kind of tease out what are the challenging things, what are the difficult things. And that may not be an action plan of 100 things, but actually it's maybe just thinking about 3, 4, 5 interventions that we as a group can make that's actually going to make a difference to people and move this agenda forward. I think we've really challenged ourselves around outcomes. So the fact that we work together to deliver outcomes is really important to me, and we need to move beyond that we do partnership well to we do partnership well and therefore we deliver better outcomes for people. How we manage that, how we measure that is an ongoing learning process for us. We're learning all the time about it. We can only do better around it. But I think that real strength of relationships between all of the partners, from the LOIP groups, the relationships with the local communities, right up through the executive and absolutely to the board, is the absolute strength and highlight. So to see that developing, and it will continue to develop, I'm absolutely sure in the coming years.